Now, to help us make sense of these numbers, Professor Guido David of OCTA Research Group is joining us this evening via the line. Sir Guido, good evening.
Hi, good evening, Riza.
Sir Guido, what can you say about today's numbers, especially on deaths? Is this a sign of a looming surge in cases?
Well, firstly, about the number of cases, we were expecting about 3,000 to 4,000 today, and this is actually in line with our expectations. I haven't done the calculations yet, but I would assume that the 7-day average in new cases in the country has decreased. It was around 4,600 yesterday, so the trend is still downward. But the high number of deaths is alarming, and this is not just a one-time thing. I mean, the 7-day average in deaths has been rising, and this is actually very, I would say, curious because right now we have more than 10% of cases. I mean, the percentage of deaths to cases is about 10%, and this I don't remember this happening anytime before. My best guess is that we're still on a downward trend, but because the cases, there are cases still rising in some parts of the country, in some of the provinces, the death rate might be higher in these areas than compared to, let's say, the NCR, where healthcare is better and more people are vaccinated.
Sure, but somehow on a good note, the positivity rate, particularly in Metro Manila, is decreasing. Can you tell us more about this?
Yes, that's actually good news. I actually tweeted that earlier today in my Twitter. I am Guido David. The positivity rate in Metro Manila actually decreased to 5% for the first time since sometime in July. So if we recall, a 5% positivity rate is actually the recommended positivity rate by the World Health Organization. It means that we are seeing a downward trend definitely in Metro Manila.
So with that being said, rather, in the given projection and the situation, do you agree with the extending of the alert level 3 status in NCR?
Well, we support the decision to extend the alert level 3 in the NCR, although actually we were supporting also a move to alert level 2, the reason being that most of the indicators in the NCR are already low. For example, positivity rate at 5% is low. The reproduction number is 0.55, which is also low. And healthcare utilization is already below 50%. In fact, it's below 40%. And that's also at low. The only indicator at moderate is the daily attack rate in the NCR. So because of these low indicators, we feel that we could actually move to alert level 2, but the IATF decided to be more cautious and retained alert level 3, and we will support that as well.
Sir, would you say we're seeing a merrier Christmas, perhaps, for most of the Filipinos in the country? And what should the public be expecting in the next coming weeks and months?
Yes, actually, I am optimistic that we'll be seeing a Merry Christmas. We're hoping that cases will decrease to about 2,000 by November, sometime before the end of November. We're hoping that cases will further decrease. And I think that most areas will probably be over the Delta variant by December. I mean, I know that some areas are still battling the Delta variant right now. For example, Dumaguete and Occidental Mindoro and Zamboanga cities just on a downward trend. But I think that they should be over the Delta surge soon.
All right, that's good news. And thank you, as always, Professor Guido David, for sharing with us your insights. That's Professor Guido David, a fellow of the OCTA Research.